Well, thank you very much. And my thanks to everyone for taking time out of their busy days today. Hopefully everyone's staying safe, um, quarantining where needed, doing all the safe social distancing things that we all need to do to keep everybody safe and healthy. And as you're doing it, you're probably spending more time with your pets, whether they're dogs or cats or other animals. And some of those pets may be really enthusiastic to have you home this much. And other of your pets may be wondering why you're invading their space this long. But let's kind of walk through today a little bit about how we can maybe manage some of that arthritis, especially if our limitations are a little bit in place now for a while now on veterinary care. So when I look at this, we really have to identify where pain is at, because arthritis can be a difficult thing to really appreciate. Is it on x-rays? Is it just on a physical exam? But I think we can all appreciate pain. And pain is an unpleasant sensory and emotional experience associated with acute tissue damage. That's kind of a wordy, mouthy diagnosis that comes out of the dictionary. What really pain boils down to is that we as veterinarians working with you guys as pet parents, we need to be advocating on behalf of animals that cannot advocate for themselves. So when we look at it as a veterinary healthcare team, every animal is going to have some sort of pain. What's our best way to opportunity to evaluate that and to treat it, especially when we have nonverbal patients? So I would ask you guys, who looks more painful to you here? The dog on the left or the dog on the right? Some of you might think that either one, nobody's painful, maybe just the terrier on the right is just a little grumpy. But maybe they're both painful. Okay, and pain can be hard to subjectively see in some of these animals when it's very mild. Is that terrier really grumpy, or is he just grumpy because he's uncomfortable? These dogs, who would think that the Labrador on the right is more uncomfortable? Right? Looking with those big sad eyes, just kind of going, what's going on? Some of you may think that that Jack Russell Terrier on the left is being painful as he's snarling at you. This dog actually has been trained to smile for the camera. So he's actually grinning back his lips. He's just happy. But again, pain could be seen as an animal who's trying to be aggressive with us and protecting themselves, or it can be seen as an animal that's very submissive and not wanting to do much. And then this dog, here's pain in a very hopefully straightforward setting. This poor dog had a nasty run-in with a porcupine, and absolutely there's pain involved in this, and we need to address those. So sometimes pain is really obvious to see, but a lot of times it's not. Because in our patients, we really have to understand what terms we're using in a veterinary care capacity. So when we talk about medications that are analgesics, those are medications that will provide pain relief without a lack of consciousness. So that's like our Advil or something like carprofen or things like that for our dogs and cats. Anesthesia is just the loss of feeling with the use of drugs, but it's just a loss of feeling. It's a loss of consciousness. It's not a pain reliever. We're not blocking those pain receptors in the body. And a sedating drug, which we may use around the 4th of July with fireworks or thunderstorms, doesn't directly relieve anybody's pain. Now, when we use it for thunderstorms, they have anxiety. So we're not using it in cases of pain, but sometimes sedative drugs are given just to quiet the animals down, but they may still be feeling pain. That's like with us, right? We may take a medication that'll calm us down, but it doesn't really address our pain if we're anxious over our pain. In our field, we talk about working as a team a lot. So we talk about the term multimodal, and that means that we're attacking pain through different pathways when we talk about multimodal analgesia. We also talk about things like preemptive analgesia, because we want to do it in anticipating pain. If we know something's going to be painful, we want to give medications ahead of time. So if you have an older arthritic dog that really enjoys those walks, but he comes back and he's really laid out and just needs to take a 3-hour nap after a 10-minute walk, that's the type of dog we'll probably want to give pain meds to before they go on their walk, so they can be a little more comfortable. Because patients with arthritis need to move. And they may not be able to walk for 3 hours on end, but if they do small, simple things throughout the day, that's a lot better than them just laying still for 12 or 16 hours at a time. Other pain terms that are important to think about are things like hyperesthesia and allodynia. And these are terms that you may start to be cognizant and aware of if you're talking with your veterinary healthcare team, because in certain conditions, the body gets so wound up that very light things that should not be painful, the patient's nervous system is now way overwired. And so light things that should not be painful now will cause them actual true pain. And that can be really challenging to deal with our own kids, our fur kids, because if we pet them and they really shudder away, it's because maybe that arthritis is not being well controlled. And so they're anticipating pain. That very light touch of a simple massage makes them uncomfortable. That's not that you're doing it wrong. It's just that we may have to reevaluate how we're evaluating their pain and how we're treating it. If we look at types of pain, it's always important to break these down, especially when we're dealing with arthritis, but in any setting, because your dog could be having arthritis and it's not that clinical, or your cat has arthritis and it's not that clinical, but then it eats something and it's vomiting and its abdomen hurts and it winds up having surgery because it ate your socks. And now that arthritic patient not only is recovering from major surgery, but is also going to be recovering from an animal that's not moving as well, so it may have an impact on their arthritis. So time frames are really important with types of pain and what we're looking for and thinking about pain. I know we're going to talk a lot about arthritis and how to manage that, but I'm a pain advocate in all aspects. So I have patients that come in that we see through our ophthalmology service that have glaucoma, and we're working to help manage their pain. We have patients that come in for all sorts of issues that have all different types of pain, especially cancer pain. Our animals are living longer. We are battling different types of cancer with them all the time. And so my job and my team's job is to work with the surgeons and with the oncologists to not only get through their surgery or maybe their chemotherapy, but how do we help them to continue to thrive and do well with whatever time they have with us. And I know we're now into October, but I think that this should be something that should be all year round. September was Animal Pain Awareness Month, and we put these flyers up in our exam rooms when we used to have people come in our exam rooms. Now we email them out to our clients. This is a poster put together by the IVAPM, the International Veterinary Academy of Pain Management, that really talks a great job about trying to find those pain things that your pets may be telling you at home. So even though they're not verbal, if we know how to listen to them, they can tell us different clues. You guys can all go to IVAPM. They have a great owner section on their website as well. But these are things I want you guys to be thinking about with your pets and possible pain. Things that we kind of take for granted, right? Oh, they don't go up the steps anymore. They're just getting old. Age is not a disease. And how do I know? Well, a couple of years ago when I ran the Marine Corps Marathon, I was 39 at the time. I got passed by a 69-year-old woman. How do I know she was 69? Because on the back of her t-shirt, as she blazed past me at mile 20, she said, "Congratulations, you just got passed by a 69-year-old. Okay, so age is not the disease. If we have simple things, our pets can still be able to do those things if they're comfortable. So if your dog's not going up and down the stairs, that's a sign that they're probably uncomfortable. If they have decreased appetite, they're not eating as well. Do they have to go across a really slick floor to balance on the floor as they get older? Maybe they don't have that coordination. Or your cat. Maybe your cat doesn't get up onto the counters anymore. Maybe it doesn't get up into the back of the couch. It stays kind of low. A lot of cats are vertical creatures and they're not getting up there because they anticipate pain either trying to get up there or they'll have pain when they're landing coming down. So these are really good things to be looking for in your pet and starting to keep an idea of what's going on with them and then talking about that with your veterinary healthcare team. Because the signs of pain, where the poster kept it really simple, but here's the intense list of things that we look for from owners. We ask them, are they hiding more? Are they growling? Are their ears pinned back? Things that we look for as a veterinary healthcare team. Are their heart rates spiked? Are there high blood pressure? There's lots of signs here, and we want to be really careful about those. And the great part is the last bullet here is things like x-rays and ultrasound and CAT scan and MRI are critically important to diagnosing arthritis. But the most fundamental diagnosis of arthritis comes from the veterinarian and the veterinary technician. When we get your history, we understand what you guys are telling us. And sometimes now with COVID, we do that through email or a FaceTime call. So we've all been adapting now how to do that a little bit differently than having those folks in our exam rooms with us, but then doing a thorough physical exam. And when I teach my residents and my interns and veterinary students, we teach everybody, if you know what normal dogs should feel like, finding the abnormals becomes very easy once you know what to look for. And that's our job. So we know what normal should be. And I advocate all of you pet parents getting to know what normal is on your dog or cat. If you go into the vet and they say he's all normal and he's acting really well, great. I'm going to prescribe a therapy for you. During COVID, I want you to pet your dog for 10 minutes a day or your cat for 10 minutes a day, every day. It's good for you. It's good for them. And if you pet them and know where their joints bend and what is comfortable and what's normal for them, then when they're not normal, it's going to stick out to you just as well. You may not know exactly what the cause of it is, but you will know that something's not right. And that's when you get to be those advocates on behalf of your pets. When we look at causes for pain, we can really cover a lot. Arthritis is probably the biggest one, but all these types of diseases that come in through a veterinary hospital can all have the potential for pain. So that's why as a veterinary pain specialist, I work with all the different departments here in our specialty hospital, because any pet that comes in has the potential to have pain. When we grade pain in our hospital, you can also do these at home. I've had owners be able to do these. These are designed by the Colorado State Veterinary Medical Center. They make a dog and a cat one, and I'm going to zoom in on one now for you. And it's a pain scale. And I like these because we laminate these when we're first teaching our team members, and they're on all of the runs and places where the animals are in the exam rooms too. Pictures, right? The pain goes from 0 to 4, and it has a picture of what the pet should be looking like and what we're looking for, right? Now this doesn't, we also do a fear and anxiety score in our practice because we're a fear-free practice. So we combine these different scorings to understand what these nonverbal patients are telling us. And we look for how they, when we look at them, what do they look back at us? Do they look happy? Do they look unsettled? Right? Look at this dog here at level 2. Right? You can start to see that in those eyes, just like that Labrador at the beginning of the presentation. And what I like about these is it reminds us that we need to reassess our pain plan if we're grading anything better than a 1. And even the ones we're on the lookout that it's going to change to a 2. So we want to keep it trending towards 0. But not just for dogs. You guys can now do this for cats. And research has allowed a lot of people to be home more. And they've actually been getting a lot of research done during COVID. I'd like to introduce what's called the Feline Grimace scale to everybody. This was a research validated study that looked at cats' ear position, eye position, size of their pupil, all these different angles in kitties that they had known physical exams and known diagnoses on. And they came up with this Grimace scale because cats will actually frown when they're uncomfortable. Right? So here's the cat on the left, just wide-eyed going, why is somebody staring at me? But the cat's very comfortable. Mild pain, right? This cat kind of looks like he has a headache a little bit, right? He's squinting his eyes a little bit. His whisker position is different. And this poor cat on the other side was in a lot of pain. Now, as part of research, they did not induce pain. These were all controlled, had previous pain, and then all of these cats got treated with appropriate pain meds. None of these animals went through anything unethical at all in order to get this research done. But they were able to identify when the pain meds started to wear off, how different cats presented themselves. So we now have this available to us so we can understand our cats better and you guys can understand them better at home. So again, know what your normals are, and it's really easy for your abnormals to stick out to you, even if you're not a trained veterinary professional. And this was just the summary on those. What I really liked about the Feline Grimace scale was they looked at 5 different points. The highest you could get for each individual point was 2. So the highest score would be 10, which would be really uncomfortable pain. And again, anything greater than a 4, we then advocate that we need to change how we're managing the pain because we're not doing it good enough in that case. So now that we understand a little bit about pain, we understand where it's coming from in our pets and how to look for it, we really want to focus the rest of this time on how to treat pain. We use a lot of NSAIDs, and NSAIDs stand for non-steroidal anti-inflammatory drugs. Same thing with people. When you're sore, if you just did a lot of lifting today or your back hurts, you could take a joint supplement. But those joint supplements are not going to kick in for 30 to 60 days. What are you going to take when you hurt? You might take Advil, right? Advil, ibuprofen is an NSAID, a non-steroidal anti-inflammatory drug, because those are really good first-line pain relievers. And they're good pain relievers in our dogs and cats as well. You know, if we think about a lot, do we take things like Vicodin or other drugs like that in the opioids? Well, opioids are helpful for relieving pain, but we usually use them around surgery because they're much more potent medication. We don't want our pets kind of drunk on Vicodin at home because there can be a little unpredictable. They can have some nausea, they can have other things. So we really want to focus on the NSAIDs, and those are really helpful to have. Then we want to get them into rehab because we don't just want to cover up the pain. We want to find out where it is. So we get x-rays and we make sure that it's just arthritis and that it's not osteoporosis or, gosh forbid, bone cancer or things like that. And then we get them into a rehab program, a physical therapy program. And this is where we may see them once or twice a week for a month or two, and then try to phase it out, just like any of you guys have been through PT at home. But you also know that if you've been through PT, if you don't do your homework, you don't really succeed. So our team advocates that we have them come in and work with us, but we only see them for 1 or 2 hours out of a 7-day week. So every pet parent gets a video guided home exercise program with all of our patients so that you know, hey, we want you to be walking 10 minutes a couple of times a day, and then we're going to add a few minutes. And here's, especially with COVID, we were doing this before COVID, but here's videos on how to do massage on your pet. Here's how to do it on these legs. And sometimes if they're really arthritic in their hips, I have owners start with massage on their front legs. Why? Well, A, we get you guys used to doing it on legs that aren't overly painful. B, if your hips hurt and you're a dog or a cat, you're putting all your weight then through your front legs and your shoulders are sore. So they're overworking, like sitting there on a rowing machine all day long. So we can have you work on the front legs for the first couple of days. Your pet gets used to that. You get used to it. You realize that we're not doing any harm here. And then you can come back to the more painful areas once you're more acclimated to doing those. We changed a lot in treating pain in the environment. So when they have to be in the hospital, we try to get them in the biggest cages or runs possible. We advocate using big orthopedic mattress dog beds in our practice so that everybody's nice and cushioned and comfortable. And now there's even dog beds that have research to back them up. They've actually had dogs that go through that have arthritis, and they put activity monitors on them. And the dogs that had arthritis that were on certain types of orthopedic dog beds were less restless at night, which means they slept better. So we use those types of beds in our hospital setting when they're here for rehab sessions with us. We're also very acutely aware of an appropriate sleep setting. So we want things nice and calm and chill in our rehab department. We usually have some music playing. We have pheromone diffusers for our dogs and cats to keep their stress to a minimum. And we watch the lighting. At home, we talk to you guys a lot about, well, what type of stairs do you have? What stairs do they have to do? Are they painted steps or wood, or do they have carpet or traction on them? These types of things maybe seem a little personal invasion sometimes on behalf of my team, but it's because we're trying to understand how your pet has to get around at home. So at home, we may make modifications to where where we want their bed to go, or we say, you know what, instead of going down the front door, which is 7 steps to get out, hey, you have that back door that's only 2 steps, let's use that. Let's make it easier on your older pet with arthritis. So home modifications are really helpful. And then, like I said, we start with our NSAIDs. There's a couple of different ones here, and I should leave this with anything here. I'm not endorsing one particular product. but they're really helpful because you can start to feel better in 2 or 3 days. We know that, right? If we're sore, we take some ibuprofen, we usually feel better the next day. So we can use these, but we can also use other modalities, because my philosophy on pain is that except in end stage cases, and even then we want to find other things, I try to have my patients on the least amount of pain meds possible, because even though they're all FDA approved and they are inherently safe, any patient could have a problem. They could have a problem if they eat that whole bottle of drugs all at once. That's an acute toxicity. So when you have your pain meds, treat your dogs and cats like kids. You treat them that way. Treat them that they're going to do something foolish too, like eat the whole bottle. So keep it up and out of the way so that they don't do that. That's one type of problem we can see with these drugs. The other one is that sometimes we can see that their liver or their GI system it doesn't agree with them. And it's not that they've been poisoned by it, but it's just that it's not one that matches perfectly with their body. So we do have to watch with blood work. We watch really carefully for their appetite, that we're not harming them by trying to make them feel better. I also like to use a lot of heat therapy. So heat therapy and cold therapy are really important components to treating pets' pain, because it's easy things for you guys to do at home. And you can put a hot pack out of this nice hydrocollator if you have a physical therapy department in your house, or you can put a bag of rice in a sock and tie up that sock and put it in your microwave for 2 or 3 minutes, and that'll be some diffuse heat. You can get a gel pack out of your freezer, but please don't use electric heating pads. The reason is that these guys don't always have the best of thermostats built into those, is the honest answer. And we can feel them and we can go, okay, this is too hot, I need to get away. But some of our pets that are either debilitated or have fallen asleep during that therapy, or if they have impaired neurologic function. And what do I mean by that? If you have a dog who's herniated a disc in their back or has really stiff spinal arthritis, they may not feel everything on their back. So it may be too hot, and then we could induce a burn. So we don't want to do that. With any hot device, we always want to check it on ourselves first, that it's not too hot. We're not going to cause harm. So I don't use electric heating pads, because they can inadvertently be left on too long, and they can really cause some damage potentially. And we don't want that to happen. But benefits of hot and cold cause a lot of good things. Cold causes blood flow constriction, so we decrease blood flow to that area. It's direct anti-inflammatory, and it is pain relieving. Heat, we bring blood flow to the area, so that can be helpful to warm muscles up before we go for a walk. But after a walk with your arthritic pets, we want to use cold therapy. I also use things like help them up harnesses entirely, so that we can get support for these pets and be able to lift them and help them stand as they fight gravity. This is the big Barker brand of dog beds that has the research study behind them to show that they are more comfortable. And this is my dog Penny, who just takes a big nap after we go for runs. This was a little bit about that study, which I'll let you guys look at a little bit more online, but they did a really good job with this study on dogs sleeping better that had arthritis. And then what I really want to spend our time on is pulsed electromagnetic field therapy, or PEMF. It's produced by what looks like an old TV antenna or TV aerial. It's very, very safe. It's safer than 1,000 cell phone batteries holding up to your head. And this is a device that creates an electromagnetic wave that tells there's an anti-inflammatory for the body. So it's a non-pharmaceutical anti-inflammatory device, and it really gets penetration into that painful tissue. And this was originally designed for people to help their bones heal in the 70s and 80s if they weren't healing well after a fracture. And it used to be these big devices, you have to be hooked up for hours on end. They've then miniaturized that technology, and it was used actually in women undergoing breast cancer surgery. And it showed that they were more comfortable and had less scarring after surgery. We've now used it in a number of patients in a couple of veterinary studies as well. And it shows that we can reduce their pain and inflammation following after spinal cord surgery, their need for less oral pain meds after surgery and in their recovery. And the device now, the Assisi Loop, is this kind of giant bracelet or necklace, and the orange field here is the electromagnetic field that it emits. So we do this in our practice to get started. The treatment times are about 15 minutes, and we may do them every 2 to 4 hours, where we do them in the hospital. We do these a lot with our TPLO patients and other patients that are going through total hip replacements with us. But we can also use them at home. So I have a lot of owners that ask me, can we use a laser at home? The answer is really not really effectively, and it's not a good use of your time and money. But an electromagnetic field device that we have good research on is an excellent thing for owners to be using at home, because it can help us to decrease the amount of pain meds that we need, and we can treat the patient in focal areas. We can treat them through their cast or through their bedding. We just can't treat over there if they have a pacemaker built in, which is pretty rare in dogs. The benefits of PEMF to the patient: we decrease pain and inflammation, we can actually accelerate wound healing. It's been FDA cleared in humans and pets, and it's very portable. We can either use the loop device, as you guys see here on this Labrador, over her knee as she's recovering, or this is my own dog, and she had to go through, I got her from the shelter and she had 2 broken femurs. And so we worked on having to re-break her legs to line up her legs because she couldn't walk with 2 broken legs. And here she is with the CCRP device that actually has 6,000 treatments in it. So it's a little bit more effective in that it's better cost effective in the long run. We know we're using it for a long time with her during her recovery. And so now for her, we can get it under both back legs at the same time. It saves us time. Or if you're a kitty cat that has sore shoulders and sore hips and a sore back, you can put the whole cat over that little bed and treat the whole cat at once. So it's really helpful that way. I don't expect owners necessarily to want to read research papers, but I did want to include some of the research that is available so that if you guys are interested, you don't just have to take my word for it. Here's a paper out of New York City at the Animal Medical Center that specifically looked at these devices after spinal cord surgery, showing that they needed less pain medications than the control group. And here's another paper looking at the recovery of spinal cord patients and dogs when using this device, that they actually got back to walking better and sooner than the controlled group. So the benefits: we can use them over implants. Since they were originally designed for women going through breast cancer surgery, this is one of the few devices that we can use over our cancer patients, as far as we know at this point. It is an anti-inflammatory device, so it's especially for those patients that maybe can't take an NSAID if it upsets their stomach or their liver. This is another way that we can help attack that and treat their pain. The average cost to a client is probably about $280, so it comes out to about $2 a treatment. But like I said, the rechargeable beds are a little bit more cost effective in the long run. And what I recommend is see if it works for your pet. Start with a loop. If you see it's benefiting them and you're going to be using the long run for treating their arthritis, especially during COVID, where it's harder to get in with veterinary teams, all of our veterinary hospitals nationwide are backed up. Everybody's bringing in their pets more, everybody's adopting pets. And we love that. We are very, very thankful to be busy and to help provide care for pets. But that is sometimes where it's taking a couple of, maybe a week or two, sometimes or longer to get in with veterinary teams, is because there's just an overwhelming volume of cases right now. So if we can do things at home to help care for your pet and help you guys to treat their arthritis, here's a great way to do that.